minutes about functional medicine. Functional medicine is a branch of medicine that looks for the causes for disease and for the processes that lead to disease instead of just looking at the symptoms and leaving it at that. We're not just diagnosing the end result, but we are trying to address the actual causes and the factors that lead to disease. So if we find out that there's a problem with detoxification, we try to improve that. If we find that there's a cause of disease because of toxins, or because of nutritional deficiencies, or because of functional problems, or behavioral or emotional issues, or other types of challenges from the environment, from inside the body, from the gastrointestinal tract, from hormones, we try to diagnose those changes, those departure from well-being, and bring them to normalcy so that the body can start healing itself. This is not just about prevention. It is also about advanced disease, because in every situation it's not enough to simply treat the symptoms. You always need to address the causes if you want to see improvement in overall health. So in functional medicine, we are using diagnosis that is totally science-based, even if it's holistic. We're looking for holistic reasons for disease. We're looking at the whole person. We're looking at all the different factors and systems of the body's physiology instead of just looking at one system. A person is not a throat. A person is not an ear, not a nose. A person is not a urinary tract. A person is a wholesome organism with many systems working together and affected by emotions, by social issues, by stress. All of those things, plus toxins and nutrient deficiencies or insufficiencies, play roles together in leading to disease, and you need to address them holistically but scientifically in functional medicine. So we are diagnosing using lab tests the different processes that lead to disease instead of just guessing. In other holistic approaches to health, there is a lot of guessing going on and a lot of belief that things that we are told are correct in the absence of scientific proof. But with holistic science, as in functional medicine, we do find out what is wrong, and functionally, almost every person has different physiological factors that are incorrect or that are inappropriate. Therefore, it's easy to diagnose what's going on. Whereas with regular medicine, allopathic or cut and drug medicine, it is just about the symptoms, and the lab tests are only designed to show you at the last phase of disease. So even if you are sick, most of the time the test will show nothing. They will only be able to tell you what you don't have, whereas with functional medicine we can tell you what indeed you have, and then we can address it.